Hi, this is Tanya Melnichuk. I'm just quickly making this recording because so many people ask me how to treat sensory overstimulation, and it's probably going to be the shortest version that I can give you of this. I'm going to be focusing on the hypokalemic kind. Hypo means low and kalemic means to do with potassium, so it's a potassium deficient sensory overstimulation. It seems to be the most common kind that we have, but there are various different things that cause it. The other kind that we know about is the hyperkalemic kind. So hyper means too much, so it's too much potassium. And when we're talking about too much, it's not that you necessarily have too much in your body, it's that you have too much inside your cells where it should not be. These things need to be balanced. So if you have the hypokalemic kind, for example, which is what I'm going to be focusing on here, your blood tests may come out fine and show that your potassium is fine, but that's because the blood is not a really good reflection of the potassium in the places where it should be in your body. Blood is not supposed to contain a lot of potassium anyway, and if your body is absorbing and balancing things normally, then your blood potassium could be a reflection of your overall potassium situation. But if your body is not distributing potassium properly, it may be that you actually do have too little in your body, even as a whole, and that what you're seeing in a blood test is that's what you got, and there's not very much inside the cells. Okay, so we're going to be talking about the hypokalemic kind. This is, of course, quite common in autistic people, but it's not only autistic people who have this problem. So many people see sensory overstimulation or sensory overload as a symptom of autism, but it's just more common among autistic people. It does occur in many other people as well, and many other people also with neurodevelopmental disabilities, bipolar people, for example, some people with schizophrenia, and then I'm going to go through some other conditions as well. Let me just talk you through basically what the main mechanisms are, and then so we can get eventually onto how to treat this. The problem is that you need to have a balance between your electrolytes in your body. Neurotransmission, which is the nerve cells sending messages, happens because of charges which happen across the membrane in your cell. In other words, they keep fluctuating. So it's a little bit like different from regular electrical currents, although in a sense that is what neurons or nerve cells are supposed to do. They're supposed to distribute electrical currents. But in this case, this works by little like holes, or what they called ion channels in the neurons, and they become charged, and like positive charge, negative charge, this kind of thing, keep fluctuating in charges, and that's called fluxes. And that's done by having the right electrolytes or charged particles in the right ratios going in and out. Complicated process, but let me just try to simplify. So that's why you need to have these things keep going in and out and in and out. And if you don't have that working well, there are all sorts of problems that can come if your ion channels are not working well, for example. That's one of the causes of sensory overstimulation. We may have congenital channelopathies, that those are diseases of the ion channel, and congenital means we're born that way, so it could be a genetic problem. We can also have acquired channelopathies, so you got sick in some way and it affected your ion channels. These channels are actually protein filled, like little holes, and that protein is the channel. The protein is produced according to a recipe which is made in your according to your genes contain the recipes for those ion channels, and if you've got genes that are a little bit funny, they're going to produce, they have a funny recipe for producing the ion channel, which is maybe not an ideal protein which it produces. So that's one potential reason why you may end up with sensory overload, because your ion channels are not ideal and are not passing the right things in the right ratios back and forth. Typically, it could be a problem with a potassium channel. It could be a problem with a calcium channel as well, because calcium and magnesium are supposed to be in balance. You'll find that often in supplements. They'll give you a CalMag supplement because they know those two are supposed to be in balance, just like potassium and sodium are supposed to be in balance. But maybe you actually have a struggle to maintain the magnesium and your body just keeps dumping it. Could be various reasons. Could be because of an ion channel problem, but it could also be because maybe your stomach or your intestines just isn't absorbing a lot. Maybe you've got an intestinal problem. Maybe it isn't acidic enough in your upper intestinal tract. So that could be a reason. Whichever way, the importance of magnesium in this equation is that you need magnesium to be able to do what is called inward rectification of your potassium. In other words, you need a certain amount of potassium in your cells, but you need the opening and closing as well of the ion channels. And magnesium acts as a kind of key or gatekeeper. And they call it gating as well, by the way. So magnesium does the gating for some of those potassium channels. If you could have a problem with a potassium channel, you could maybe have a problem with the gating of that potassium channel. So magnesium is needed in the right quantities to keep the potassium in. And that's why when we treat sensory overload, we often start with magnesium first, just to make sure you've got a right amount of magnesium for the gating. Now, I've got experience with some people, especially in young children, where if they get given a magnesium supplement, the whole of sensory overload just resolves. And it seems to be because they've had the potassium that they needed in their body anyway. And the problem was with the magnesium not being there to gate certain ion channels. So the magnesium can resolve it. But that doesn't resolve it for everybody, because it's one thing to have the gatekeeper or the key. It's another thing to have the thing that's supposed to go in through the gate, which is your potassium. So typically one might start off supplementing with magnesium in a lowish dose and then ramping it up and then following that with magnesium. That's one way to treat it. Okay, so I've spoken about one potential way of getting a potassium deficiency. The other one that can mimic that is a fetal alcohol syndrome. Some aspects of that can cause potassium loss in the same way as an ion channel disease does, but there might not be an ion channel disease present. Of course, you could have two, both things. You could be autistic, have an ion channel disease, and have a fetal alcohol syndrome. It will not necessarily show up in an intellectual disability. It's a spectrum. So there's many different ways in which fetal alcohol syndrome can reflect. You don't necessarily have the facial features of somebody with fetal alcohol syndrome, even if you do have that. You may have some cerebellar problems in the back of your brain, which gets slightly deformed. There's all sorts of manifestations that it could have, but it can affect your sensory sensitivity, and it can cause similar things to ion channel diseases. Just coming back to ion channel diseases for a moment. I mentioned the potassium channel as being one, and there was emerging research coming out in about 2013, 2014, 15, somewhere around there, about the emerging role of potassium, inwardly rectifying potassium channels in epilepsy and in autism. That was revised about a year later, but that was one of the papers that led my friend Benjamin Gerber onto going down this route to discovering and looking more deeply into the things that could help us as autistic people. That was that particular paper. Subsequently, we discovered that calcium channels, so it's also an ion channel, but it's intended for the passing through of calcium ions. So ions then are charged particles. Okay, so calcium channels can also be a problem, and there are specific gene problems that, or at least genetic mutations that can cause problems in calcium ion channels. They're quite, well, I wouldn't say they're common in autistic people, but it's common that if you have that kind of ion channel disease or that kind of genetic mutation, that you will also be autistic. And I could name a number of them now, but I'm not going to go down that route. Just to say that if you have some of those ion channel problems, you can very well also have things like hyperkalemic periodic paralysis, where you're fully conscious but you struggle to move and you struggle to even breathe. And if you get taken into the hospital because you fainted, that's where you have to be, have a message written on your chest as this is happening, so that they don't accidentally give you a saline drip, which is salt. It could kill you, because this is exactly what you don't need in that moment. But if they have any sense, they will actually check what is going on with your blood, and then they will probably see, well, they don't necessarily see if it's an ion channel problem. They won't necessarily see the problem in your blood either. So it's good to be able to have some kind of a medic alert type of paper or wristband or something to alert people to the fact that that may happen and that they shouldn't put you on saline. Okay, so I've spoken about calcium channels, potassium channels that can lead to this. There are other aspects of calcium homeostasis that can contribute to it. That is, what homeostasis is your body is supposed to keep things in balance. And calcium homeostasis is like the calcium distribution and its functions throughout the body is supposed to be kept in balance. But there are several different problems, especially in autistic people, to do with calcium, not only ion channel problems. And this, once again, this does not affect all autistic people, because autism is not a uniform condition which people have in various different degrees. It's actually a collective term for a bunch of different things which from the outside may have some similarities. Okay. So there are other reasons, other problems with calcium as well. Now, this is where I've mentioned so far magnesium as a supplement. I've mentioned that one might need, well, yeah, usually, but not always, you'd need to add potassium as well at a later stage. Another thing to add would be, which helps with calcium homeostasis and with inflammation, which can contribute to all this, is taurine. Now, taurine is a good supplement for this for a whole number of different reasons, and I've certainly found people who are on an approach of taking magnesium and potassium supplementation for sensory overload and adding taurine, and then when the pharmacy ran out of taurine, they found a significant difference. It wasn't working as well at all, and they could detect that big difference. I also take taurine. I regularly take magnesium, and I occasionally take potassium. Not everybody can take taurine. If you have a CBS gene mutation, for example, then you can have a problem processing thiols. Thiols are sulfur compounds, and taurine is one of them. So then you wouldn't want to have that because your body is making too much of it already. So then you would leave that. But for people who have problems with that, they will usually know by being sensitive to onions and cruciferous vegetables, the stinky ones, the cauliflower, for example. So then you don't want the taurine, but otherwise you can take the taurine as well. Right, so let me just go on to some other reasons why you may have sensory overstimulation. You could be sick. You could have lost a lot of your electrolytes through vomiting, through diarrhea, and then your body is depleted and you become highly sensitive suddenly to smells and to cleaning agents, and you just feel awful and just hits you in the nose, and everything is sensitive to touch. So you need to replenish your electrolytes. If this has been very prolonged, beware of something called refeeding syndrome, and read up about that. If you are actually sort of starved, if you have anorexia, if you're starved for some other reason, it's also possible, in fact, to be fat and yet to be starved of micronutrients. But if we're not dealing with that, then you're just dealing with your slow replenishment of your electrolytes. One of the ways in which we do that, the slow replenishment, I mentioned taking magnesium, kind of ramping it up. You can do that according to what it says on, like the bottle, how many magnesiums to take per day. You may end up finding that you need a bit more of both magnesium and potassium than it says on the bottle. But if you're going to ramp that up, do that extremely slowly, because taking too much potassium can give you palpitations. Right, so I was talking about sickness and replenishing there. One way to do that as well is to use Multiforce, and you can look that up. Not every country has this. It's made by A. Vogel, or A. Vogel, as the English would say. It's a mixture of electrolytes. It's usually used as a kind of antacid. because it is used as that, you have to be careful because it can make your stomach alkaline, which is what you don't want. So don't take it along with a meal. It will affect your digestion. If you're going to use that root, and it is often used for children, you could also find your country's equivalent of that. Take a look at the ingredient declaration, see what it has. So it's a powder. Usually we'll suggest the one that doesn't have a flavor. Dissolve it in water, schluck that down. It doesn't really taste like much. And so it's also easier to give to children who can't swallow pills. Doctors prescribe this for children for sensory overstimulation in the area where I am. The doctors that we've worked with have started to adopt this. Sometimes the doses may be a little bit low because every person is different. But when you do start with this, you can just increase gradually. And I'm not going to give very specific doses other than the fact that you could perhaps start with what the bottle says as in a way. I know one boy who, to make sure that it doesn't affect his digestion, he would set the alarm clock as a schoolboy for very early in the morning, take his swig of Multiforce, go back to sleep, and then get up some hours later for breakfast. So we spoke about sickness where you could lose electrolytes. Another way of losing electrolytes, and these things can be in combination, by the way. So you could have the thing from the ion channels, or you could have the thing from the ion channels and your stomach isn't absorbing properly and you've been sick, for example. Another one is that medications commonly given to autistic people can contribute to the phenomenon. So Risperidone or Risperdal, and it used to actually mention hypokalemia, so potassium deficiency, as a potential side effect on the very large leaflet that comes with it. But nowadays, it doesn't seem to have that on anymore, strangely enough. And yet, I've known people who've been on Risperidone for years, then collapsed. One child collapsed in the classroom, got periodic paralysis, taken to the hospital from severe magnesium and potassium depletion as a result of being on Risperidone for so many years. It's a medication which maybe in the short term could be useful for some people, but for many people, there have been so many lawsuits about the things that can go wrong with that medication. So I really would not suggest that as something that most people should have, particularly not children. Definitely don't put the elderly onto it just because you think it's going to keep them calm. It can cause a lot of problems. The other thing that can cause problems is Ritalin, methylphenidate, concerta, those kinds of medications. And that's partially because it causes you to urinate a lot, so you can lose electrolytes through your urine. I have a friend who is in prison who is malnourished by the prison diet. She's not autistic. And she started to display symptoms which people would associate with autism, and she started feeling like she was going crazy. The other prisoners thought she was crazy, and she was trying to hide this, but she was starting to lose speech as well from her severe deficiencies. Now, I recognize the symptoms of the deficiencies, but it was very difficult for her to get access to prison officials who would test her, even in prison hospital, test her for these things. So she did eventually manage to get to an outside hospital, obviously shackled and so on, where they tested her electrolytes, and she was so depleted that she had not defecated for weeks because her magnesium was so low. She had severe constipation, extremely severe migraines, severe vision fluctuations, and once the hospital then prescribed the electrolytes again, she took them as a supplement. The prison diet just simply didn't have the nutrition that's needed in there, and her speech returned to normal, the sensory overstimulation returned to normal. So that then briefly is how the mechanisms of sensory overstimulation. And there's another one that I kind of forgot to add, and it's super important. It's important also in autistic people, and that is craniocervical instability and a whole lot of other spinal problems. The problem with that is it also can lead to potassium deficiency, brainstem impingement of nerves. All of these things can lead also to a potassium deficiency. And sometimes with people who have those injuries in the upper spine, those could be people with Ehlers-Danlos syndrome, joint hypermobility, connective tissue disorders, but it can also come from injury. It could come from tethered cord, which is where your spinal cord is like pinched, and as you grow, it could be from birth that it's like that, and as you grow, it stretches out and start causing more and more problems. And because things that pass through your spinal column as well affect everything lower down in your body. Your vagus nerve goes through the top of your spine. Gradually a whole lot of stuff starts packing up in your body. So people who have some of these problems may end up with conditions like mast cell disorders, mitochondrial disorders, lots of allergies, postural orthostatic tachycardia syndrome, which is where you stand upright and then your heart rate goes like shoots through the roof. People who have that particular condition need sodium supplementation to increase their blood pressure so that it doesn't like flop and then go up. So they tend to be on sodium supplements. But if they have sensory overstimulation as well, they will also need potassium in addition to the sodium. Sodium won't be enough. It would, if you just have the sodium on its own, it will compete with the potassium. Those two are antagonists. So you would need the potassium as well usually. And you may need some of the other things which I've mentioned as well, such as your magnesium. I wanted to say something else more about parts. Oh, yes, okay. Potassium is also a kickstarter to the so-called methylation process. If you have problems with high histamine and you're taking a lot of histamines, then you're usually treating the end product of a process which is going wrong much earlier. Histamine affects about 250 body processes. I'm rounding it off to something here now. I know it's not exactly that number, but it's over 200. And if you're just treating your sniffles with antihistamines, you might not be looking at where this is all coming from your mast cells, and that your mast cells are releasing too much of certain substances, and there's maybe even have some gene variants or even some gene mutations which affect this whole pathway. So to be able to kickstart methylation, this process which is necessary for a whole lot of body processes and which also affects histamine, you'd need potassium for that as well anyway. So potassium is going to be necessary if you're dealing with some of these chronic illness conditions which affects many autistic people and their non-autistic relatives, and that also affect people with upper spinal injuries, with issues such as craniocervical instability, with Chiari type 2 malformation, which is a kind of like hernia of the brain, of the cerebellum. All of those things are going to need potassium. Your monitoring of your potassium is difficult sometimes for doctors to do, because potassium, as I said, the blood tests, even from a pathology perspective, in other words, if you send it to the lab, there's all sorts of tests you can do for potassium, but some of them just end up not being accurate or not being reliable. So you really need to start becoming very aware and very observant of what your own let's say signs are that you're moving towards either a magnesium or a potassium deficiency. And look at what some of those signs could be. Read widely about signs of potassium deficiency, signs of magnesium deficiency, and signs of other electrolyte deficiencies as well. Perhaps I should mention some experiences of my own with trying to self-treat. I've now been free of sensory overstimulation for many years. Let me see, about 7 years now. And other friends have had a good drastic reduction in it as well. Some of them have also completely eliminated. But I'm on maintenance treatment all the time, so I do need to take magnesium regularly and from time to time potassium as well. And I will very soon become magnesium depleted if I do not supplement regularly. Not everybody is the same, and that some people, once they've kind of treated once, then they don't need to revisit. Just make sure you eat your broccoli and your magnesium foods. You don't necessarily need to supplement. However, I do. My body just dumps magnesium. Now, initially when I started treating, I had magnesium oil spray, I had magnesium glycinate, I had lots of magnesium, and it was working well. My leg cramps were reduced, my constipation went away, headaches went away, sensory overload went away, and so I was just treating myself with a lot of this magnesium. And then my leg cramps came back, and I was rubbing on more and more magnesium oil spray. Well, you can overdo these things. So what was effectively happening, I was told, is that if you pump your cells full of magnesium like this, which is basically what I was doing, you can start to create little ruptures in your cell membrane. There's too much going into the inside, and then it starts coming out again. And that, then when these little ruptures happen, the calcium flows into your cells, and you will get exactly the same effect as if you have too much calcium, too little magnesium, which causes cramps. Now you think you've got too little magnesium because you associate your leg cramps with your magnesium deficiency. But look at other symptoms. Look at what's happening with the rest of your body. Your eyes may be starting to fluctuate in vision in a weird way that you haven't had before. Maybe you're starting to get diarrhea, which is associated with too much magnesium, too little calcium. So those imbalances and things are things that you can do to yourself if you overdo it. So watch your symptoms, be aware of what all the different symptoms are if you're going to do this. So that, in a nutshell, then, is some of the etiologies, the causes of sensory overstimulation, the route to treatment, what types of magnesium to take, what types of potassium to take. While it really differs per person, I've mentioned something like Multiforce. What I usually do myself is I use magnesium glycinate. It's well absorbed, crosses the blood-brain barrier pretty well. It's a bit more expensive. And I just take a chelated potassium, what I can find usually. I'm not very specific about my potassium. Sometimes I take a magnesium citrate, potassium citrate combination, and that's also because I've had a kidney stone before. So that's a good thing to have to prevent further kidney stones. There I would also want to look at not eating as much peanut butter as I ate before I got that kidney stone. It's high in oxalates and can easily cause a kidney stone. So when I was eating peanut butter, I like to make sure that I'm eating my magnesium and potassium citrate as well, to just perhaps counteract that or deal with what I'm doing to my body. But yeah, so those are some of the different ones that I might use. Other people might use something different. With my friend in prison, it was very difficult to get supplements to her. The prison is very sticky about you bringing in any kind of powders or this or that or medicines which are not prescribed by this doctor. And so she was in a lot of suffering until she was able to get to the hospital. But one thing that we were able to supply, and which they did allow for a while, was for her to get a sealed packet of Epsom salts. And that is not usually used medicinally internally. But if you can get nothing else, and if you can afford nothing else, then Epsom salts at least contains magnesium, and in small quantities you can drink it. And it's not as well absorbed as everything else. Beware of the larger quantities. You will vomit, you'll get diarrhea. But in small quantities it can help, and it has made a difference to people who could afford nothing else. Also very inexpensive. A caution just on Epsom salts and on drinking it. Epsom salts are magnesium sulfate. So if you are one of the people, as the aforementioned, that you're sensitive to sulfur compounds, which some people, especially some people with connective tissue disorders, it just seems to be a common comorbidity. If you have Ehlers-Danlos syndrome, for example, maybe you could be sensitive to sulfur. So also to sulfates. So that won't work for you. Then bathing in Epsom salts, which can provide relief to a lot of people, like using big quantities of it, that might be something which is disturbing to you as well. I've known of an autistic teenager getting seizures from bathing in Epsom salts. So it's not for everybody. And as I mentioned in the start, autism is not a uniform condition. It's not something that people have in degrees. It's a variety of different phenomena which all fall under this one umbrella, and so autistic people can be quite different from each other. What I've discussed here, though, are trends among us and commonalities within this cluster of clusters of disabilities. Once again, does not affect only autistic people. Okay, I hope that's been helpful and that gives you a departure point to treating yourself, to discussing things with a medical professional. We usually, when we advise these approaches, I always try to involve a medical professional like a doctor to do some of the monitoring. They are frequently not aware of these things. So they need to be briefed on this. They need to be made aware of the research, which is unfortunately not all in one place. You have to jump around to go to many different research papers and many different areas of learning to be able to brief them. But once doctors are briefed on this, they can monitor this. We do find, though, however, that some doctors just not interested in learning, and that's where autistic people who are able to take their health into their own hands can do some of these things themselves. Just be careful of the quantities you used, as I mentioned, especially with potassium. You can give yourself palpitations. Beware of that. Just adding on at the end, though, there are some conditions where people with certain genetic anomalies, where you will find that if you have sensory overload, you're also sensitive to certain kinds of anesthetics, or you're less sensitive to some of them. So, like instead of going under anesthesia, you get like numb, so you can't move, but you remain fully conscious, or the dental anesthetics don't work well with you. Those kinds of things could occur in combination. People who have that type of combination will tend to also get sensory overstimulation when they eat high carbohydrate foods. So lowering your carbohydrates, which I do anyway, I'm on a low carbohydrate, medium fat diet, that can be helpful. Anything that you can do for your intestines, for example, I don't take gluten, don't take dairy, even though I don't have celiac disease or anything like that, but it's just to lower the risk and just to make it perhaps easier for my intestines to absorb things. Okay, so not high carbohydrates create inflammation as it is anyway, which can be a contributing factor to your sensory overstimulation, as can some of the other things I mentioned. Even high histamine can contribute to that. So just to mention that the other type of sensory overstimulation, the hyperkalemic kind, the kind where you have too much potassium, sometimes people find that out through actually trying to supplement with potassium and then feeling extremely bad and feeling way worse. And they need the opposite protocol. They will need less potassium. They will find that they actually feel better when they take more carbohydrates. So very much the opposite of what is the more common form here, which is the one which responds badly to carbohydrates and requires more potassium. If you try the approach and you just notice no difference, chances are your craniocervical instability or your spinal problem may be so severe that it's just not, the supplementation is just not helping, because it keeps on recurring as a result of what's happening in your neck and the impingement there, or the scraping on your, the nerves which are going through your spine. And the abrasive effect, I'm not sure that that's the right term, but the CCI guys will be able to talk about that a little bit more astutely than I will. I think I keep on trying to wrap up, and I'm thinking of more things that I need to say, but I think that should be enough to get you going, enough to get the discussions going, enough to have you looking towards treating the problem that you may have with sensory overstimulation.